Hi, I'm Dr. Julian Abrams, and I'm here today with Dr. Charles Lightdale at Columbia University Medical Center. And we're going to present our paper entitled Nitrous Oxide Cryotherapy for Treatment of Esophageal Squamous Cell Neoplasia, Initial Multicenter International Experience with a Novel Portable Cryoballoon Ablation System. The authors are Drs. Kanto, Abrams, Kunzli, Wustin, Almario, Komatsu, Jobe, and Lightdale from 4 academic centers in the United States and the Netherlands. So Dr. Lightdale, what information is presented in this article?
So we're presenting the first combined study of really a feasibility study of testing this novel cryoablation device, the cryoballoon focal ablation device, to treat early squamous cell neoplasia in the esophagus.
Very good. So who were the patients who were included in this analysis?
So there were 10 patients, 7 patients with high-grade dysplasia, 2 with low-grade dysplasia, 1 patient with squamous cell mucosal cancer who was treated partially with endoscopic mucosal resection.
And had these patients ever undergone prior treatments, or had they been treated before?
Yes, it was a mixture. Some had been partially treated with other treatments, and others were treated for the first time with this treatment.
And how are these treatments performed?
So they were performed by inserting the balloon catheter through a therapeutic endoscope. The device is then positioned in the area of the lesion and targeted to treat that specific lesion. All of these lesions are identified with squamous cell neoplasia using Lugol's iodine spray, which stains the normal esophageal mucosa brown and leaves the neoplastic areas unstained, so they stand out very starkly against the brown background.
And each one of these sprays, how long does this last for? Does this take a long time, or is this short, the spray itself?
The spray itself varies. We used 8 seconds, 10 seconds, and 12 seconds. And the nice thing about this spray device is that that short treatment is enough. It's sufficient with this balloon device. It doesn't require freezing and thawing, freezing and thawing. So it's just one treatment and you're done.
All right. Why don't we demonstrate how this device works? So there's this handle that has a gyroscope and a motor inside, and then the catheter is just connected through here.
Okay, and you do a pre-puff just to inflate the balloon, nitrous oxide, and then you can move the handle to move the device hole so that it aims right at the lesion, and then hit the trigger and it'll spray the cryogen right on the lesion. And that's all there is to it. And then it can be positioned to treat another area if necessary.
Very good. So for the analyses for this study, the primary outcome was the absence of neoplasia 3 months after the initial treatment. They also looked at serious adverse events as well as technical success, strictures, whether or not patients required narcotics, and then long-term follow-up, including whether or not there was neoplasia on the last endoscopy. Could you briefly summarize that data?
Yes. At the 3-month checkup, all 10 patients had complete disappearance of all of the unstained lesions, and biopsies in the areas of those lesions showed no further evidence of esophageal squamous cell neoplasia. So that, in terms of efficacy, looked very successful. Several of the patients had some pain immediately after the procedure. They were successfully treated with the use of narcotic analgesics, but after 24 to 48 hours, almost all the patients were pain-free. So that's a nice advantage of this treatment as well. There were 2 strictures that occurred in the patients who received circumferential treatment. And when you have lesions that are circumferential in the esophagus, almost every treatment that you use for endoscopic eradication has a stricture risk. So, and this included. So we perhaps could modify the dosimetry to try to decrease that rate, but right now the stricture rate is still there at about 2 out of 10.
So I think further studies are still needed in larger patient populations to really validate these findings in terms of treatment success and complications, to refine the dosimetry. But I think to summarize, we could say that at least based on the findings from this case series, that this cryoballoon treatment for squamous neoplasia seems to be feasible, had relatively good success rates, and with an acceptable safety profile. Would you agree with that?
I would, and we're looking forward to bigger studies with this device in esophageal squamous cell neoplasia. There's an important study going on in China right now, which is a prospective study, open label study that will give us, I think, a lot more information in a larger context. And that's going to be important. But I'm encouraged by this study, and I think it's a first. So I think it was good to have it available.
So look forward to learning more about this exciting new device. Thank you.